What drew you to a career in oncology nursing, specifically in the chemotherapy unit?
My passion for oncology nursing, particularly in the chemotherapy unit, stems from a profound desire to support patients through one of the most challenging experiences of their lives. I've always been drawn to nursing for its blend of compassion and science, and oncology nursing allows me to deepen that commitment by caring for patients facing cancer's complexities. The chemotherapy unit specifically provides an opportunity to build long-term relationships with patients and their families, supporting them not only physically but also emotionally. Each chemotherapy session becomes a unique interaction where I can offer encouragement, monitor for critical signs, and adapt to evolving patient needs, ensuring they feel supported and understood at every stage. My training and experience have prepared me to administer chemotherapy safely while managing side effects and educating patients on managing their symptoms. Oncology nursing requires a comprehensive understanding of treatment regimens and the ability to think critically under pressure. What I find most fulfilling is witnessing patients' resilience and playing a direct role in their journey toward healing. Working in the chemotherapy unit allows me to make a difference, not only in managing their treatment but also in being a compassionate presence, which I believe can truly impact their experience and outcomes.
How do you approach building rapport and trust with cancer patients and their families?
Building rapport and trust with cancer patients and their families begins with creating an environment of empathy and openness from the very first interaction. I approach each patient as an individual with unique fears, needs, and hopes, making it a priority to listen actively and respect their personal experiences. By allowing patients and families to share their concerns, I gain insight into what matters most to them, which helps me tailor my care and communication to be as meaningful and supportive as possible. When discussing treatment plans or daily care, I make an effort to explain complex medical information in a clear and compassionate way, ensuring they feel informed and empowered in their journey. Recognizing that cancer treatment can be overwhelming, I encourage patients to ask questions, and I address each one thoughtfully to build their confidence in the process. Consistency in my actions is also key. Being reliable and following through on my commitments builds trust and reassures patients and families that I am genuinely invested in their well-being. Finally, I strive to create a safe space where patients and families feel they can express emotions without judgment. Whether they need to talk through their fears, ask difficult questions, or simply have someone to lean on, I am there to support them. By showing compassion, respecting their autonomy, and maintaining open lines of communication, I work to build a relationship that fosters trust and comfort throughout their treatment journey.
Can you describe a challenging situation you faced in an oncology setting and how you handled it?
One challenging situation I encountered in an oncology setting involved a patient who was experiencing severe side effects from chemotherapy and was considering discontinuing treatment. She was understandably distressed and frustrated, and her family was also feeling the strain. I recognized that this was not only a physical challenge but an emotional one, and I approached it with sensitivity and patience. My first step was to actively listen to her concerns, allowing her to express her fears and frustrations without feeling rushed or judged. This helped to create a safe space where she felt heard and understood. Once she had shared her thoughts, I provided information on options to help manage her side effects, discussing potential adjustments with a medical team and possible medications to alleviate discomfort. I explained each suggestion clearly to ensure she understood her options and how they could improve her quality of life without compromising her treatment plan. I also took time to involve her family in these discussions, recognizing the importance of their support and perspective. After this collaborative approach, the patient felt more empowered and decided to continue with her treatment, knowing she had a dedicated team working to make the experience as manageable as possible. This situation reinforced the importance of compassion, clear communication, and teamwork in helping patients overcome difficult moments in their journey.
What is your experience with administering chemotherapy and managing side effects?
I have extensive experience in administering chemotherapy and managing its side effects, having worked directly with oncology patients in both outpatient and inpatient settings. My training includes a comprehensive understanding of chemotherapy protocols, safe handling, and the precise calculations required to ensure accurate dosing. Each patient is unique, and I follow strict guidelines to monitor vital signs and assess their immediate reactions before, during, and after the infusion. By doing so, I can catch any adverse reactions early and respond promptly, which is critical for patient safety. Managing side effects is an integral part of my role, as many patients experience a range of symptoms, from nausea and fatigue to more complex issues like neutropenia and neuropathy. I make it a point to educate patients on what to expect and how to manage side effects at home, including strategies for hydration, nutrition, and rest. I also collaborate with the healthcare team to adjust treatment plans and introduce supportive therapies, like antiemetics, when necessary to improve patient comfort. Building a rapport with patients also helps, as they are more likely to report symptoms early, allowing for timely interventions. My goal is to provide compassionate and skilled care that not only supports the efficacy of their treatment, but also makes their experience as tolerable as possible.
How do you stay updated on the latest advancements in cancer treatment and chemotherapy administration?
Staying updated on the latest advancements in cancer treatment and chemotherapy administration is a priority for me, as the oncology field is continually evolving. I actively engage in professional development by attending oncology-specific conferences and seminars, which provide insights into new treatments, emerging research, and improved patient care techniques. I'm also a member of several professional organizations, such as the Oncology Nursing Society, which offers a wealth of resources like webinars, journals, and workshops focused on current practices and innovations in oncology nursing. In addition to formal learning, I routinely review reputable oncology and nursing journals to keep abreast of clinical trials and treatment advancements. I work closely with my colleagues and physicians in a collaborative environment where sharing knowledge is encouraged, so I'm constantly learning from their expertise and experiences as well. Furthermore, I participate in any training sessions my institution offers on updated protocols and new chemotherapy drugs, which helps ensure that my practice aligns with the latest standards of care. By committing to continuous education, I can provide safe, effective, and evidence-based care that meets the needs of my patients.
How do you manage the emotional and psychological needs of cancer patients?
Managing the emotional and psychological needs of cancer patients requires a compassionate and holistic approach, as their journey is often as mentally challenging as it is physically demanding. I begin by creating a safe, empathetic environment where patients feel comfortable expressing their fears, frustrations, and hopes. Actively listening to them and acknowledging their emotions without judgment is fundamental in establishing trust, and it allows me to tailor my support based on their unique needs. Sometimes this means just being a present, calming presence during their treatment sessions or providing reassurance when they feel overwhelmed. In addition to offering emotional support myself, I encourage patients to connect with resources that can further assist them, such as counseling services, support groups, or therapy programs specifically designed for cancer patients. I work closely with a multidisciplinary team that includes social workers and mental health professionals to ensure patients have a network of support beyond our immediate interactions. When appropriate, I also involve their family members and educate them on how to provide emotional support, which can be invaluable for the patient's well-being. I prioritize maintaining an open line of communication, inviting patients to share their feelings regularly, and empowering them to ask questions about their treatment. By addressing both their emotional and physical needs, I strive to help patients find a sense of stability and hope, which can be incredibly empowering as they navigate the challenges of cancer treatment.
How do you ensure patient safety and prevent complications during chemotherapy administration?
Ensuring patient safety during chemotherapy administration is paramount, as the treatment involves potent drugs that require precise handling and monitoring. I begin with meticulous preparation, double-checking each patient's identity, the chemotherapy drug, dosage, and administration route according to established protocols. This verification process often involves a second nurse to confirm accuracy, reinforcing our commitment to patient safety. I carefully review each patient's medical history, lab results, and recent assessments to ensure there are no contraindications or factors that might increase the risk of complications. During administration, I monitor patients closely for any immediate side effects, such as allergic reactions or infusion site issues. By regularly checking vital signs and observing for any signs of discomfort or unusual reactions, I can respond quickly if complications arise. Additionally, I make it a point to educate patients on what to expect during and after their chemotherapy sessions, so they're empowered to report any concerning symptoms early. I also collaborate with the rest of the healthcare team to ensure that any necessary supportive medications, like antiemetics or hydration therapy, are administered as needed to reduce side effects and enhance patient comfort. Preventing infection and contamination is another critical aspect, so I adhere strictly to infection control measures, including wearing protective equipment and using aseptic techniques when handling and administering chemotherapy agents. By following these precautions and maintaining vigilant communication with both patients and colleagues, I'm able to minimize risks and create a safe treatment environment.
How do you calculate chemotherapy doses and monitor for adverse reactions?
Calculating chemotherapy doses requires precision and a deep understanding of each patient's unique needs. Doses are typically based on factors like body surface area, BSA, renal and liver function, and sometimes weight, so I start by accurately calculating these variables using the most up-to-date patient data. I double-check all calculations with a colleague, following my institution's protocol for dose verification to ensure the dosage aligns with the oncologist's orders and is appropriate for the patient's clinical status. When adjustments are necessary due to factors like organ function or previous toxicities, I collaborate with the oncologist to determine a safe and effective dose. During administration, I am vigilant for any adverse reactions, especially in the initial phases of treatment when the patient's response to chemotherapy is less predictable. I'll monitor vital signs, assess for early symptoms of reactions, such as itching, shortness of breath, or flushing, and maintain a keen awareness of delayed symptoms like gastrointestinal distress or neuropathy. If a reaction occurs, I act quickly to stop the infusion, stabilize the patient, and follow the emergency response protocols, which often include administering supportive medications like antihistamines or corticosteroids. After each treatment, I continue to monitor patients for any delayed side effects, providing them with information on what to watch for at home and when to seek medical help. My aim is to maintain a safe, supportive environment throughout the entire process, where patients feel informed and comfortable reaching out if they experience any symptoms.
What is your experience with managing chemotherapy-related side effects, such as nausea, vomiting, and hair loss?
I have extensive experience managing a range of chemotherapy-related side effects, including nausea, vomiting, and hair loss, and I approach these challenges with a focus on both prevention and patient education. For nausea and vomiting, I work closely with the healthcare team to ensure antiemetic medications are administered preemptively, often before the chemotherapy infusion begins, and then adjusted as needed based on the patient's response. I educate patients on practical dietary tips, such as eating smaller, frequent meals and avoiding strong odors, to help them manage nausea between treatments. When breakthrough symptoms occur, I assess their severity and coordinate with the team to adjust medications or provide additional supportive care so patients feel relief as quickly as possible. Hair loss, though not physically painful, can be emotionally challenging. I offer empathetic support and guidance, preparing patients by discussing the likelihood and timeline of hair loss with them. I also provide resources such as information on wig fittings or head coverings and connect patients with support groups or counseling services if they're struggling with the emotional impact. Throughout, I strive to maintain open communication, inviting patients to express any concerns and helping them feel more in control of their treatment journey. Managing these side effects is about providing both practical and emotional support to help patients maintain as much comfort and quality of life as possible during chemotherapy.
How do you ensure safe handling and disposal of chemotherapy medications?
Ensuring the safe handling and disposal of chemotherapy medications is critical to protect both patients and healthcare staff from exposure. I strictly follow established protocols for preparing and administering these potent drugs, which include using appropriate personal protective equipment, PPE, like gloves, gowns, and eye protection to minimize the risk of contact or inhalation. When handling chemotherapy medications, I work within a dedicated area, often using specialized equipment such as a biological safety cabinet, which provides an additional layer of containment. During administration, I am vigilant about preventing spills or leaks, using closed-system transfer devices whenever possible to further reduce exposure. After treatment, I carefully dispose of all materials that have come in contact with chemotherapy agents, including syringes, for tubing and PP, in designated, clearly marked containers. These containers are later disposed of following hazardous waste guidelines to ensure the materials do not pose a risk to others. I also ensure that patients and their families are educated about safety precautions at home, especially if any chemotherapy drugs or body fluids are handled there. This includes proper storage, disposal of contaminated items, and hygiene practices to protect everyone involved. By adhering to these strict safety measures, I can manage chemotherapy medications responsibly, prioritizing the well-being of both patients and my healthcare team.